Good afternoon, ladies and gentlemen, fellow college short lecture participant in the 4th International Conference on Biophysical Technology in Dentistry. For the first, let me introduce myself. I am Rini Sitanaya from Polytechnic of Health Ministry, Makassar, Indonesia. Today, I will present the result of our research on the effect of antiretroviral therapy on HIV/AIDS patients to changes in salivary acidity and plaque index. The purpose of this research is to examine the relationship between antiretroviral treatment of HIV/AIDS patient with plaque index and salivary acidity and the relationship between duration of antiretroviral treatment on these two variables. HIV or human immunodeficiency virus is a virus that attacks the human immune system, whereas AIDS or acquired immunodeficiency syndrome is an immune syndrome by HIV infection. The virus enters through the intermediates of blood, semen, and vaginal secretion. Most infections, 75%, are caused by sexual relations. After the expert discovered that AIDS was caused by HIV, virus study about drugs that could eliminate this virus began. The drug used in HIV virus therapy is called antiretroviral therapy. Each HIV patient needs antiretroviral therapy to suppress the amount of virus in the blood so it does not progress to the AIDS stage. The antiretroviral therapy aim is to maximize suppression of viral replication to undetectable levels for as long as possible and also maintain and improve immune function and minimizing drug toxicity. Combination therapy can slow down the progression of the disease, improve survival, maintain immune and virological responses, and inhibit the development of viral mutation and preventing drug resistance being used. Although it can increase patient life expectancy, but the main problem that must be taken into consideration is the side effect of this drug, especially the problem it causes in oral cavity. A case regarding the adverse effect of antiretroviral therapy was reported like oral lesion on lip and buccal mucosa, taste disorders, dry mouth, xerostomia, and a burning feeling in the mucosa. Accumulation of plaque on the tooth surface can cause various periodontal disease. The research was carried out at Yayasan Peduli Kelompok Dukungan Sebaya or YPKDS Makassar, Indonesia. The studies use an observational analytic method with cross-sectional design that is by directly measuring the acidity of saliva and checking the plaque index in 100 samples of HIV/AIDS patients who's taking antiretroviral drugs. And the result of our research can be seen as follows. Now, let's look at the table 1. Here it can be seen that patients who use antiretroviral drugs for less than 5 years had the most plaque index value in the good category for the FCD antiretroviral type. Meanwhile, for patients who have used antiretroviral drugs for more than 5 years, the best plaque index value were found mostly in patients taking deferral antiretroviral drugs. Meanwhile, in Table 2, we can see that the use of antiretroviral drugs for both less than 5 years and more than 5 years overall show that saliva has become more acidic, and this occurs in all types of antiretroviral drugs used by our respondent. In the table 3, show that from 5 of the type antiretroviral drugs, Neviral has a significant relationship with salivary acidity variables. So that we may conclude that overall the types of antiretroviral have a significant relationship to salivary acidity variable. But whole type of antiretroviral has no significant relationship to the plaque index variable. In the other side, Table 4 show that p-value of salivary acidity variable and plaque index is greater than 0.05. So it can be concluded that the duration of drug use less than 5 years or more than 5 years has no significant or unrelated relationship to acidity of saliva and plaque index. The p-value seen of salivary acidity variable was smaller than used for more than 5 years compared to use for less than 5 years. The plaque index variable p-value is smaller at a period of more than 5 years than less 5 years. In this study, we have examined 100 respondents from HIV/AIDS patients in Yayasan Peduli Kelompok Dukungan Sebaya or YPKDS Makassar and found that 70 people with acid salivary and 28 people with natural salivary acidity. From the chi-square test, this value indicated that salivary acidity has a significant relationship to the type of antiretroviral drugs consumed by the sample, but does not show significant correlation to the duration of consumption. No significant relationship was found between the plaque index value and the received antiretroviral therapy, both in terms of type of antiretroviral and duration of use. This is show that there is a relationship between antiretroviral therapy with hyposalivation and xerostomia. Apparently, antiretroviral therapy presents a potential risk in reducing salivary flow, and most importantly, this risk can increase depending on the duration of therapy. In line with Sarafani et al. 2013, examined the dental health status of 190 HIV-positive people, also finding that antiretroviral were considered a risk factor that play an important role in decreasing the level of salivary flow and enlarged salivary glands in HIV-positive patients. It also observed that most antiretroviral had higher sugar concentration and some in syrup form and below critical acidity value, which made a oral cavity vulnerable to dental caries, tooth loss, and increased caries index. In index plaque examination from 100 patients, we were found that there is 76 patients who have good plaque score and only 6 were bad. No significant relationship was found between the plaque index value and the received antiretroviral therapy, both of the type of antiretroviral and duration of use. This study stated the value of index plaque itself is not directly affected by the consumption of antiretroviral due to behavior factor and habit of individual in caring for their dental health, such as the habit of brushing teeth, the use of interdental aids, periodic visit to dentists, as well as education and motivation. Subjective factors such as oral hygiene habits, nutrition, access to dental health services, as well as training and prevention program provided to these patients while in care. Besides that, it was mentioned there is a positive correlation between the use of dental health services with employment status and insurance ownership because for those who have jobs, it is more likely to get access to regular dental checkup services. The health education and motivation programs conducted by the member of YPKDS every month have a positive contribution so that the member of YPKDS have the awareness to have a healthy lifestyle such as brushing twice a day, use mouthwash, and visit to dentist. Members of YPKDS have access to designated health facility to carry out special health services to them, including dental health services at puskesmas or hospital. Mentoring programs, both motivation and counseling, conducted by fellow inmates, also have a positive influence on them. And the last conclusion of our research that there is a relationship between antiretroviral treatment in HIV/AIDS patients with salivary acidity. While the duration of antiretroviral treatment in people with HIV/AIDS is not related to plaque index or salivary acidity. Okay, these are all our presentation about the result of our study on the effect using antiretroviral therapy on changes in salivary acidity and plaque index in HIV/AIDS patients. We hope that all of you can enjoy our presentation and what we have presented is useful to all of you. That's all and thank you very much for your attention.